By definition, research means a rigorous inquiry into the world around us of management of business. I think there are multiple ways in which research comes into the classroom and is useful to the students in a business school. Just as a researcher, your thinking is far more rigorous. You are constantly trying to parse what's the quality of the evidence, what works, what does not work. And so you are that much more reluctant to throw statements at students. So we say that ISB is a research-driven school, and almost everything that we do at the school is centered around research. Now, by definition, research means a rigorous inquiry into the world around us of management of business. But on top of it, we also emphasize that the research that the faculty do must be relevant to the context. In particular here, what are the big burning problems in India that require a careful analysis? And sometimes what we study in India is also applicable to other emerging markets, other low and middle income countries. And we really want to be leaders in generating these new insights and thoughts. I think there are multiple ways in which research comes into the classroom and is useful to the students in a business school. Just as a researcher, your thinking is far more rigorous. You are constantly trying to parse what's the quality of the evidence, what works, what does not work. And so you are that much more reluctant to throw statements at students. You're very measured in telling the students what's a good approach, what's not a good approach. Often you can back it up with actual references and results of previous research studies. But even beyond that, for example, my research is in healthcare systems, and I teach an elective to MBA students on the topic. This is 20 hours of material only on how to design effective healthcare systems. So one example of analyzing healthcare delivery systems in my research is a project that we did a few years ago in Malawi in Africa. The goal there was to improve sample collection and transportation system. As you can imagine, in a low middle income country, these operations of collecting samples, taking them to the labs is very expensive. And the organization that was doing it for the country were running what we call as fixed routing algorithms. So someone would go and pick up samples from a particular clinic on a particular day. But when they reach to a clinic, they would often realize that there are no samples to be picked up. So which means you've incurred a cost. So we said, why can't we convert this so-called push system into a pull system? And that required us to have information about how many samples are ready to be picked up at every clinic at the end of every day. And we devised a low-tech solution for this because smartphones are not easily available. And so we used so-called dumb phones or feature phones to collect this information routinely every day. And then we ran an algorithm using all this data that gave different routes to the riders every day. So no longer fixed routes. And based on this algorithm and the way riders implemented this, we could reduce transportation times significantly without incurring any additional cost. And that reduction in sample collection time and the time that it takes to deliver the results back can actually help initiate people on treatment earlier and therefore improve their outcomes.